Good morning, all. Am I audible?
Yes, sir.
Yes, sir.
Okay. Good morning. We are starting our reading club with the prayer.
हमको मन की शक्ति देना, मन विजय करे, दूसरों के जैसे पहले खुद को जय करे। हमको मन की शक्ति देना, मन विजय करे, दूसरों के जैसे पहले खुद को जय करे। हमको मन की शक्ति देना, भेद भाव अपने दिल से साफ कर सके, दोस्तों से भूल हो तो माफ कर सके, झूठ से बचे रहे, सच कदम भरे, दूसरों के जैसे पहले खुद को जय करे। हमको मन की शक्ति देना, मुश्किलें पड़े तो हम पर हित न कर्म कर, साथ दे तो धर्म का, चले तो धर्म पर, खुद पे हौसला रहे, बदी से ना डरे, दूसरों के जैसे पहले खुद को जय करे। हमको मन की शक्ति देना।
Good morning, all. We tribute to a great master, Samuel Hahnemann, for this divine science and who taught us dare to be wise. seeking blessings from our Guru, Dr. Prafull Vijayakar sirs, who have made this divine science and combined with the modern science to make homeopathy easy like mathematics. Jai Hanuman, Jai Homeopathy, Om Vijay Karaya Namaha. So friends, we are in the journey of reading practical part of Organon of Medicines along with the Sir book Verbatim, the workshop conducted in 2002 at Mahabaleshwar. So up till now in Organon, we have completed the case taking part and we are continuing with the knowledge of the medicines. So we are starting with the aphorism number 108. Therefore, there is no other possible way in which the peculiar effect of medicines on the health of individuals can be accurately ascertained. There is no sure, no more natural way of accomplish this object than to administer the several medicines experimentally in a moderate doses to healthy persons in order to ascertain what changes, symptoms, and sign of their influence each individually produce on the health of body and of the mind, and that is to say, what disease ailment they are able and tend to produce. Since, as has been demonstrated in aphorism number 24 to 27, all the curative power of medicines lies in this power they possess of changing the state of man's health and is revealed by observations of the later. So why this idea came to Master Hahnemann? Meanwhile, the Master Hahnemann has writing the Cullen's Materia Medica, and he found the one word that the the Peruvian bark produce ague-like symptoms because of its bitterness, and on the basis of that, he found that the hypothesis, if it is like that due to bitterness, so there are many bitter substances that also produce the ague-like symptoms. But he started experimenting on himself that if I am a healthy and I am taking that Peruvian bark, what will happen? So he took that Peruvian bark or a cinchona and he found that he developed ague-like symptoms. So, on the basis of that conclusion, he found that the real power of certain medicine has to be understood by applying into the healthy persons, and then we can understand that the law of similia. Then he found that the law of similia, that those medicines which produce the disease, the same medicines when we apply to the diseased persons, it will cure, and that is what the hypothesis has been supported by the experiment, and that's why he suggested that if you want to know the peculiar effect or the pathogenic effect of the medicines, then and then you need to apply that medicines to the healthy individual, and that is what the pure experiment on the human frame. And the observation has to be concluded. So this is what the idea came from that time. So he said that no one single physician, as far as I know, during the previous 2,500 years, thought of this so natural, so absolutely necessary, and only genuine mode of testing medicine for their pure and peculiar effect in deranging the health of man, in order to learn what morbid state each medicine is capable of curing, except the great immortal Albert von Heller. He alone, beside myself, saw the necessity of this. So this is what he know that Albert von Heller has tried this process of drug proving, and the only persons in this 2,500 years who found that testing the medications, genuine mode of testing the medications and their pure effect has been only found on applying into healthy men. So this is what he had made the one sentence in the italics language, and it suggests that the same things. But no one, not a single physician, attended to or follow up this invaluable hint. Albert von Heller has given a hint, but no one followed this hint, and that is what the master has picked up that hint, and he started proving the drug on himself and his friends and family, and then he found that the symptoms has to be collected, and that's why he had made the pure materia medica, that is called materia medica pura, from the experiments of a drug proven. So, friends, we are in the continuing journey of reading the book Verbatims, the workshop conducted by Dr. Prafull Vijayakar sir at Mahabaleshwar in 2002. So, we are reading this and continuing the chapter. So, we are continuing the chapter 18. So up till now, we have seen many aspects of learning. So we have seen the understanding of the miasm, we have seen understanding of the defense mechanism, we have seen the approach of the skin, we have seen a different approach, GCS approach, the acute emergency approach. And yesterday we have seen in acute cases, you have the five Pancha Mahabhuta, and whenever you came across the acute exacerbation of the chronic disease, then the approach has been changed. So, and also in the day before too, we have seen the approach of autisms and everything. So, this is what we have to understand, that how the Dr. Vijay sir has connected this modern science with the old homeopathy, that Master Hanuman's wisdom, and that is what we are learning. So, we are continuing this journey in the chapter 18. So what Dr. Vijayakar says that I am now very happy that I can now sit and relax. My teammates are now getting excellent result and also have a good teaching ability. This gives me a great breathing space. We will continue our journey into interior of the man to understand man in disease and in the cure. As I told you, we are the only institutions, or perhaps in the whole world, which is elaborating more on the follow-up rather than the prescribing part. Once you know which directions you have to move in, what you are supposed to encounter during cure, you are dead sure whether you are right or wrong. If you go wrong again and again, this gives you an inquisitiveness. Why am I going wrong? And ultimately, you start prescribing right. So, failure is a stepping stone to the success. If you know your failure, then you only can correct it. So this is what something that don't hesitate with the failure, because the failure is the stepping stone to success, and if you know your failure then and then you can correct it. Otherwise you are in the delusional state that you are right always. So ignorance is not the bliss. When you are treating a human body and dealing with the most precious of the man's possessions, that is life, this type of practice makes a homeopath conscientious. It is very important for us to see the return of the disease, which gives us immense pleasure. I insist that Herring's law of cure should be seen in every disease except in case of compensatory cure. So this is what very important aspect of understanding. If you do not get to see the Herring's law, then what are the problems? Your materia medica is not perfect, your history taking is not perfect, or your application is not. There are the three ways that you can have to look for. So if you don't find any Herring's law in your case, then you can think of that my knowledge of materia medica is not perfect, my history taking is not perfect, or the applications of the medicine is not perfect. So materia medica comes from the three types of the pictures in the sora, psychosis, or the syphilis. Unfortunately, materia medica which we follow is not there in any books. So I go from repertory to make a pictures. So sir has advised that if you want to understand the materia medica, you have to read the repertory, and from repertory you have to create pictures of materia medica of particular remedy. So sometimes you find the polarity pictures, that one remedy has the aversion as well as the desire. So you can think that it is a polarity, but it is not like the polarity. It is something that it is a miasmatically from one stage to another stage to the another stage. So that is what Dr. Vijayakar has proposed. I go from repertory to make a pictures. I take a rubric and see which are the group of remedy coming up. For example, rubric anxiety. So maximums are the kalis, then calcarea, next, then the acids, then the polycrest remedy like arsenic, sulfur, etc. So there are group of remedy which comes into this depending on the anxiety that the patient comes with. For example, if you get anguish, hurriedness, if you do not get this, does that means that you are never going to give argentum nitricum. If it is a psychotic argentum nitricum, then no anxiety, nervousness, etc. will be seen because it will be concealed and the patient cover himself beautifully. He is hiding, he is psychotic. So this will prevent him from telling you what he actually is. This there are so many times when the patient wants to hide something about him, for example, extramarital affairs. He does not want to disclose this because of his position, his status. Therefore, take a plain innate characteristic like a will, intellect, moral, and come to the core. So sometimes the era of psychosis, right now, what the era of psychosis, we are in this era. So this is what we have to make ourselves that we have to conclude something from the innate characteristic because the person is hiding everything. So we are starting with the case, the example. We will see the two cases. The case, the 38 years aged male came in with the chief complaint of the severe occipital headache which start from the left occiput and then spread in front and then the entire head start paining. He had a vomiting and sweating with the severe headache. His headache was aggravated on reading in the sun with the tensions, loud noise, and a light. He also had acidity. So many a time we came across same type of patients. So what was the ailment from? About 8 years back, he went to Middle East through an agent who promised him a prestigious job in the Saudi Royal Army. His relative gave him a big farewell before going there on the prestigious appointment. To this surprise and disappointment, he found that he was deceived. He had been given a job of a motor mechanic in the Saudi paramilitary force. He returned back and did not show his face or meet any of his relatives. I was literally hiding and running away from my relatives for 6 to 8 months. This was a very stressful period for me, during which time I started getting this headache. So this is what something the ailment has started. Investigations, the MRI dated on the October 1999. The cystic cum solid mass measuring 2 centimeter by the 1.7 centimeter seen in the sella. The left side of this mass is a solid. It enhances after contrast and is hypointense on the T2 weighted image. The mild supracellular extension is noted minimally, indenting the optic chiasma, likely a pituitary adenoma. This is benign pure psychosis and not oncogenesis or syphilis. No other abnormality is noted. So it is something that a pituitary microadenoma or a macroadenoma. It's a large size, 2 centimeter by 1.7 centimeter. So it's a macroadenoma. Prolactin level was done. It was 686 nanogram per ml. Normal it is 15. The field of vision normal, so there is no compressions on the optic chiasma. He was advised tablet bromocriptine 2.5 milligram to suppress the prolactin level and the tablet Cybelium 5 milligram daily for the headache. Now the case is a pituitary adenoma malignant or non-malignant? The question is like this. Mostly it is benign, it is a pure psychosis at work and no oncogene has been found. Oncogenes means the actual onset of the cancer. When cancer starts, the genetic code is changed because there is a substitution. It is like a few pages of a part, one book are removed and instead few pages of the part 2 book are introduced. So it does not make any sense. Then the whole image of the constitution since birth does not become the important for us, and hence we have to change our approach of treating the cancer. So here sir has given the idea of differentiation between the psychosis and the cancer. So if we have a cancer, for example, if oncogenes are present, the onset of the cancer. When the cancer is there, it is thought that the genetic code has been changed. So this is the approach of the cancer. So one part of the book is replaced with the another part of the book. So this book does not make any sense. So that means the constitution is not important in this case. We must have to remove the book or the part of that book first, and then we have to replace it with the normal one. So that is what the whole image of the constitution since birth does not become important for us, and hence we have to change our approach of treating the cancer. So in cancer, we have to treat the part, not the constitution. So that is what Dr. Vijayakar has advised. The personal history, sorry, the appetite was normal, craving nothing particular. Thirst is decreased, stool normal, sleep normal, sweat profuse, thermally hot. So this is what we have the hot, thirstless constitutions. Family history, mother has diabetes and hypertension. Now the process start of nature. So stays with the wife and the three children. The first child 10 years old, the second child 6 year old, and the third child 4 year old, and the younger brother. He was irritable but always suppressed it. He was reserved by nature, makes friends with the simple people, will not make friends with the quarrelsome and extra smart people, get impressed by the people's good nature and not by their money. Very attached to the children, worries about them a lot. If they are ill, he will remain awake for them. The family-oriented man does not like fight, quarrel in the family, will think about everybody, brother, sister, parents, not only for his wife and children. Now does job in a Saudi consulate at Mumbai, punctual in his work, not otherwise. So only work, he is punctual in only work, not in whole aspect. The speed is fast, loves brain teaser, like playing games on internet for hours, like reading novels, not fond of watching TV and traveling. Fastidious and systematic, contented, no demand, like simple living. I do not want a lot of money, but such a state should not come in my life where I have to ask for others. So this is what something he want. So he's contented. Very cautious, never prefer taking undue risk, think before taking decisions, plans out things, and think before talking. So this is what the man is. A religious personality, never criticize other religions, says a person should be good, anxiety of his disease, sympathetic with women and children, not with men, as men are for struggling and bearing problem. Never had a fight with the wife, never back answer to the elder even when they shout, though it is not his mistake. Fond of good clothes and buy good quality items. So this is the case. Now we need to treat the psychotic disease, and we have all the psychotic parameter in the patients. As you know, that prolactin has been increasing, and the pituitary adenoma is there, and he gone to a stressful situation where he got deceived. He was advised that he was given a good job in the Royal Army, and finally he landed with the job of motor mechanic in the Saudi paramilitary force. So he feels he was being deceived and disappointment from this, and then he came back to India, and he was hiding and running away from relatives for 6 to 8 months. So this was the reaction, and then the headache has been started. So what could be the inference we can take from? We have irritable but angry and a suppressed kind of personality, very reserved kind of personality, attached to the family and children, sympathetic toward the females and children, family oriented, fastidious, little bit intellectual personality, contented, but because of the fear, he was cautious and having religious and never fight and fond of good clothes. So, what could be the entry point in our case? So, this is what we have to take into consideration. This is the case. So, what rubric do we take? Take the whole pictures. Yes, fear will come to want possibility. Yes, but he said he was a contented that if the fear will come to want, then he could not be contented personality. He would be very, very discontented personality. He wants everything, want, and want. So he goes into a state of a greed and everything. So that is what fear will come to want. But here the person is very, very contented. He said, na. I like simple living. I do not want lot of money, but such a state should not come in my life where I can ask for. Yes, embarrassment can be one of the reactions. Absolutely right, doctor. Because he was hiding from. Okay. Now ask yourself that does embarrassment cause the pituitary macroadenoma? The question you have to ask yourself. So this is the exercise you have to do with your brain so that you can understand that we are going in the right direction or we are going in a wrong direction. So that is what you have to ask yourself. So embarrassment can be one of the reason. So we are starting with the process. So take the whole picture as per aphorism number 5 and the disposition. So we are proceeding. Yes, absolutely deceived. So if we take a deceived being, so we have only three, four remedies in our materia medica or a repertory. One is a ruta, another one is drosera, and there are two more remedies are there. I generally used to prescribe a Drosera and Ruta in one of two cases. So yeah, maybe I don't know about Ignatia, but it is there. Four remedies are there in that rubric. So deceive is one of the reason. But see, the disposition is most important. The one situation is the ailment, and the reactions of the person decide you that is genetic. So here we need to prescribe the GCS. So in GCS, our reactions is most important. So we are proceeding in the way of Hahnemann said that ailment from the miasm, the physical constitutions, the will, the intellect, the moral. So what could be the will, intellect, moral as of the patient and the environmental factor and reaction and his defense mechanism. So we have to find out. See, many a time we are in the way of going into a feeling. So feeling is something that is the emotions, but we need to treat the will, intellect, and moral of the persons. So that is what the GCS is. Sometimes feeling gives you emotions, and that emotional reaction gives you just the neurochemical changes, and mostly you can take the feelings into acute cases, purely acute cases, asoric cases, where you get the good result. But whenever you are in the state of treating a more psychotic or a psychosyphilitic cases, and at that time when you have to prescribe a GCS, at that time you do not go enter through the feelings because feeling is something that is emotional, that is for a particular time being. And remember that he had this chronic pain and he got this 8 years back. You know, the ailment 8 years back. So remember that this 8 year back ailment is starting right now also. No, this is something that it is a starting point. Okay, but something that the reactions of that individual decide that his disposition is most important. What he had done in this span. So that is what you have to take care of. So feeling is something like a emotions. So we are continuing the reading that here what sir has showed that the we are proceeding. So we need to understand that the ailment from the miasm, the physical constitution, the will, intellect, moral. Here the patient felt deceived. This is the query, you know. So what do we take? Ailment from deceptions or ambition deceived or the reaction is embarrassment, rightly said by Dr. Sivam. So do we take that? So what is to be taken into consideration? So it is the reactions. What is the reaction? He is hiding, not allowing himself to be seen, did not show his face to anyone for a 6 month. So we take the ailment from embarrassment. So that is what very important, rightly said by Dr. Shima. So this is something that the reactions decide that we need a remedy which is very, very sensitive to the embarrassment, and that is why it is not the element, but it is something that the constitution is reacting in this form, and that's why the embarrassment has to be taken into consideration, not the deception. So deception is the situation, actual situation is there. If there is no situation is there and he feels he is deceived, then it is a delusional state. Okay, but here it is the actual situations. But after that situation, what was his reaction is the most important. So reaction is something like this. The whole family had given him a huge treat on a farewell. So many gifts and had been given to him, and here he find himself as a mechanic. This was the constitution that was such who did not get angry. If it had been angry remedy, see, if it is an angry remedy, we think of the aconite, mercury, colocin, nocromica, chamomilla would be came up. But it is not angry remedy. I remember the friend of mine whose son had gone abroad. He did not like it there and he just came back. He too had got lot of gifts. When asked, now where are the gifts? He said, oh, they are all used up. Totally shameless. So this is what the reaction is. So here the one fine patient having the reaction that is I don't want to show my face to society because of they have given me a lot of gifts and everything. And one patient is like that, oh, they are used up. So this is something the shameless. So you need to understand the person is like this. The reaction is most important. So this is apart from the case, the another line. Again, the person's is a very positive remedy like a ferrum would have managed it there and there itself. Now we go got one strong factor. This constitution is affected by the embarrassment to cause a tumor. So this is what very important. In frank syphilitic cases, where he would have suppressed anger, he would have suffered from paralysis, motor neuron disease, or Parkinson disease, or myocardial infarctions. But it is not the frank syphilitic case, it is a psychotic case. All are syphilitic. So, anger, rage, sudden fright are all syphilitic. So, here, whenever you find the frank syphilitic, you need to find out these are the causes. If someone's mother dies, the reaction can be, oh my God, I am all alone. Now who is there? When my mother died, my reaction was anger. So this is something a different reaction. Why I could not save her? I was literally hitting the wall. So the reaction differ with the same situation, whereas my father was very contented and said, do not worry, she has lived her life. If she would have lived long, she would have suffered more. So there is a grief, anger, and contentment. So this is what something the situations remain one, but the reactions of the individuals remain different, and that is because of their sensitivity. So one fellow says that I could not save my mother, so he was angry on himself, okay, hitting the wall so that he might go into a autoimmune state. But the another person that says he said that he lived a very good life, no worries. So he had a grief, but he is contented. So this is what he goes into a psychotic state. So this is what something that you need to understand. So in every situations, the different remedy react differently. This is our learning of this case for today's. So do not take element from deceptions, derailment, or a financial loss. I have found that there are three, four final emotions that comes out. So ailment from anger suppressed, ailment, grief, embarrassment, indignation, and joy. So these are the few emotions. There was a lady, this is another case. There was a lady came to me with a severe headache. I probed all her emotional problems in the family. Any death? Did your servant leave you, or did anyone or leave you, or your child was sick, or where you were vaccinated, antibiotic, or dental treatment? I wanted to see what protein has disturbed her protein imbalance. So the patient says, Doctor, nothing happened. On the contrary, last full week was very good for me. My dream come true. I wanted my own house. We got one and gave a grand opening. I invited all my relatives to see. I was proud on her. Everyone was appreciating that within a few months of employment, I have been able to take a house of my own. I was on a cloud nine, and that's it is. So, with this, here the ailment from joy is the general. So, here you can think of this ailment from this was another case. So, you have to understand that whenever there is a situation is happening, you can think of it may be the anger suppressed, it may be the grief, embarrassment, or it may be the indignation, or it may be the joy. So in this case, the lady having a joy and the general thirst, thermals and dispositions on the basis of that sir prescribed coffea and she recovered like a magic. So neurotransmitter causes imbalance and the disease. So this is what something the acute case. So therefore the ailment from is important also when there is a acute condition. There is a relationship between the anger and the destructive disease. There is between grief and the psychotic disease, and the ordinary anxiety and emotionals are the psoric disease. So there are the different ailment according to the miasm was given by the sun. Okay. So on the whole, what do you find about this? See, the element is things, but what do you find about this? The person can be very mild, person can be very result, do not make friends and quarrel with the quarrelsome people, and do not like to fight and timid. So the timid personality, very attached to the families and children. So the affectionate, the punctuals only for the work, not otherwise. He is therefore not conscientious. So if he is punctually everywhere, so he might be conscientious. Systematic, keep things where he can always find the intellectual, like a brain teaser, so that is intellectual game. He was contented, no wants, like simple living. I do not want lot of money, but such a state could not come in my life where I have to ask for from others. Very cautious, never prefer taking undue risk, thinks before taking the decisions, sympathetic with the women and children, with the weaker sections of the society. He is a giver. He like to give and not to take. So he is a benevolent kind of personality. Never had a fight with the wife. This indicates he is a mild and contented and satisfied with his wife. Fond of good clothes, buy good quality item. This only tell me that he need a psychotic remedy. So on the basis of this, everything is psychosis. This is cover up. Take such symptoms only if the intensity is too high or a pathology. So whenever you find any psychosis and you have a psychotic symptom, but in that psychosis, if you find that that psychosis symptoms is very intense or a high, then and then you can take the psychotic symptoms into considerations. Those who do not know the defense mechanisms of the miasm at the physical level do not know what pituitary adenoma is psychotic. Okay, so here we need to treat the psychosis. So anxiety for the family, anxiety for the children. So we take first ailment from embarrassment, that is what the reactions plus contented plus benevolence plus cautious. These are the non-disease characteristic of that personality, which we called as innate characteristic. Sorry, hot and thirstless. So on the basis of what remedy could be comes into your mind? If we have this five symptoms, embarrassment, contented, benevolence, cautious, what remedy comes to your mind? Causticum. Causticum is a chili remedy. So the remedy came up are the causticum, carcinosin, sulfur, arsenical, nectarmure, opium, pulsatilla, etc. Now we have to rule in, rule out each and every remedy. So sulfur is coming up the highest. We have added unnecessary rubrics. I am just trying to show you this is what happened when you put garbage in, garbage out. So anxiety for family and children is a sorry rubric. Today his gear of defense has changed and he is in a psychotic now. If we take only three rubric ailment from embarrassment plus contented plus benign, the only remedy came up is opium. The psychotic peoples are only benevolent, like Tata, Birla, Ambani, big businessmen, industries. They give after they have accumulated much. Also, the patient says, I should earn so much that I can give. I should not ask for others, ask from the others. A sorry person will never give. He will only work and work to earn money, name, fame, and their charity. So even if you take up only two rubric ailment from embarrassment plus contented, then only the staphylococcus and opium come up, but the staphylococcus is chilling. So contentment is here in this case is a psychotic. It is again a cover up stresses. So he has what appear to be apparent contentment. If he was contented, then why did he have to go to the Saudi to earn more money? So this is what you have to ask yourself. So contentment can be soric, can be psychotic, but never syphilitic. This is what Sir has written. But sometimes the opium goes or magnesium goes into contentment, that is a syphilitic contentment. So warts grow and stay. wants to grow and stay there on the body. They are contented there. So this is what Watts will tell you. They are contented there. Similarly, there is a mental contentment because there is a fear of going still further, or fear of going down, or fear of losing the present reputed positions. That gives a contentment because of cautiousness. So here the cautiousness is most important. So on the basis of that, we gave him opium 201 dose on October 1990. After few days, he came and said that he get headache between 11 to 4 p.m. and he is better after 4 p.m. So after a few days, his headache were much better. He had slight pain in the last week twice, and the skin eczema came up. He was generally ameliorated. The CT scan on October 1990 shows the pituitary edema in the 6 months after. The pain and the pressure in his eye was much better. The tumor was pressing on the optic chiasma. The giddiness was better. Previously, it was difficult for him to work. Now he can work easily. Patient is not very expressive. Answer short and abrupt. Now we will see the latest report. So on October 1990 was available for the comparison. So comparison with the previous MRI shows the substantial shrinkage of the pituitary adenoma with alteration in its shape and morphology. On a T1 weighted image, the solid component appear more hyperintense when compared to the previous scan, while the cystic component has regressed completely. On the contrast, enhanced scan, the tumor is relatively hypovascular compared to the enhancing pituitary gland. So, growth was at cost of the normal body part. Now tumor is getting hypovascular. Automatically the multiplication will also decrease. The residual tumor now is 13 mm by 9 mm by 8.3 mm. Previously it was the 2 centimeters, so it is a 20 mm. So it is situated in the left lobe and displaces the normal pituitary towards the right. The infundibulum is also displaced towards the right. There is no compressions of the optic apparatus. The brain parenchyma appear normal. There is no polyp, retention chest in the left maxillary sinus. Now, what does this means from the Herring's law of cure? The displacement is still there, but from more important eye optic chiasma to the lesser important organ now. Supposing on MRI there is no change in the size of the tumor, then only from this you know that the medicine is working. It is receding from more important organ. So this is what compression has been reduced. So conclusion from the MRI report. So comparison with the MRI dated, this shows the substantial shrinkage of the pituitary adenoma and changes in its morphology. The residual tumor now measure about 13 mm by 9 mm by 8%. There is no comparisons of the optic apparatus. Now MRI dated 27/1/2001. Pre and post contract MRI of the brain was performed using T1, T2 weighted image at multiple plane. The patient is a known case of pituitary macroadenoma. Previous MRI was in May 2000 was available for a comparison. Compared to the previous MRI, the residual solid component is enhancing less than normal pituitary gland. The left half of the gland has further shrunken and appear less conspicuous. It is now measured approximately 8.7 mm and 4 mm. The stalk is still deviated to the right. There is no compressions of the optic apparatus. So from 20 mm, it becomes 8.7 mm. The brain parenchyma appear normal. Incidentally noted as is a polyp retention cyst in the left maxillary sinus. So this is incidentally. So what is the significance of this incidental polyps or cyst? The growth is more important organ is shrinking and it has come down to the nasal polyp or sinus. So conclusion, in comparison with the previous MRI, there is further regressions of the solid component in the left half of the pituitary glands. Again in April 2002, after 1 year, the pre and post contrast MRI of the brain was performed. The patient is follow-up case of the pituitary macroadenoma on the bromocriptine. So this was written by the MRI report. There is a normal homogeneous enhancement of the pituitary gland which measure 4 to 5 mm in its maximum height. Residual T2 weight signal abnormality is seen in the left half. The stalk is deviated to the right. The supra and the paracellular structure appear normal. The brain parenchyma appear normal. Incidentally noted is a polyp retention cyst in left medullary sinus. Virtual complete regressions of the pituitary macroadenoma. The residual gliosis is present. Now, what Suarez is glia are still in the excess. Glia are still in the excess. So residual gliosis is present. So this is psychotic only. The process start with the gliosis and then it become a tumor, then solid mass and then cystic mass. So there is no polyp, no mention of it as also. Here psychosis has now regressed. Pituitary adenoma is due to tumor virus and one that causes chickenpox in the children and tumor in the adult. It ended on the skin. It came on the ectoderm straight away. It has to come out or this particular destructive force does not go. So this was in the 2001. The last month he brought his daughter with the same complaint, the pituitary adenoma. Now we shall start with the second case. I will again demonstrate the Herring's law of cure. This is only to impress upon mind from where it can come how. So bromocriptine cannot reverse the whole things from the psychotic to soric. If at all it does, it will take you to the higher disease. Only one dose was given. So this is what something the bromocriptine was also given. But bromocriptine only work on the prolactin level and it only suppresses the prolactin. By suppressing only prolactin, it cannot reduce the tumor size. So this is what something that our medicine has been work on. And the only one dose of opium was given. So this is what the case and the follow-up. So in follow-up also you have to remember that what was the things has to be reducing. So that is giving you the idea that the cystic is really there is a solid, then solid also reducing the side, and then the uh, lower part. That means the incidental polyp has been seen in the sinus. So that polyp is something that the psychosis from the higher important organ goes to the lower, and it comes out in the coryza. Another case, the case two, this was a child who brought to me with the hemangioma tumor above the lower lip, palates, and the cheek. So this is what something that the hemangioma on the face, right lip, palate, and cheek. The history when she was 10 days old, she developed the indigestion from the milk and vomiting and the diarrhea from the milk. She was hospitalized in the first month. Her vomiting stopped after allopathic medicines. Then, in the first month, the child started having lacrimations and her parents used eye drops as advised by the physician. After hospitalization, the child became very angry, cranky, and stubborn. After the first month, she developed small spot on the face, size of a mole. At the age of 2 3 months, these spots increased rapidly. At 2 months of the age, she had a projectile vomiting with the convulsion. The brain is now affected. What Dr. Vijayakar sir says, why did she start having vomiting from the milk in the first place? How can a child develop lactose intolerance on the 10 days only? Why not on the third or fourth days? Nothing can happen in this world without a cause. So cause was vaccination. So normal IgG level, we can think of it as a 77% IgA is a 17% IgM, IgD, and IgE is from the rest 6%. With vaccinations, IgG goes up. That is the whole balance of the 100 is disturbed, but totally it always has to be 100. By vaccination, it goes up by the 10%, so it become 87%. So somewhere something has to go wrong. So IgA goes down and it will sacrifice the body mechanism. So body's mechanism is very intelligent. So IgA is secreted by the epithelium of the skin and mucous membrane of the endoderm. That is the respiratory tract, GIT, urinary tract, and conjunctiva. So what happens? These are more prone to the infections. This protein imbalance causes the child to have some problem whenever the child has immune impairment. So his GIT has become very sensitive to the milk. Intolerance begins. Was the child born with it? No, it is due to vaccination. So there was also a suppression by the allopathic medicines. So the immune impairment was not allowed to exhibit. itself. So the sora, the inflammation started exhibiting from the more important organs, the conjunctiva, and then it goes to the projectile vomiting. Now the impaired immunity went to the eye, and this child started getting lacrimations. Now what happened? Now this subsided with the and the child become cranky and irritable. So neurochemicals has been changing. The sora has been suppressed more. Now the spots, which were of the size of the mole, develop into hemangioma after the age of 2 or 3 months. She then developed a projectile vomiting. So the doctor suspected something. There were angiomatous growth. So the growth tendency went into the circulatory system, and the angiomatous malformation was seen on the upper lip in the middle line, extending upward along the nasal bridge into the preseptal regions and the right orbit with the associated intracranial vascular malformations in the suprasellar prepontine right cerebropontine system, and she was diagnosed with the Sturge-Weber syndrome. So this is what something you can think of. So gradually one swelling developed on upper lip, second one on the right side of the nose, third one just above that, and the fourth one was inside the right eyelid, because of which the right eye closed completely. Now you will have a clear understanding of how the disease has been progressed, the journey of disease, how it went from ectoderm to endoderm in terms of defense. So video clipping dated July 1994, the child with hemangioma looking like a Lord Ganesha. So this was the observation. After 1 week of the treatment, the right eye had opened up little. Let us see the history first. So this is one follow-up has shown that after 1 week, the right eye has been little open. So due to hemangioma, the right eye has been closed completely. Physical general appetite was normal, craving for the lemon juice, sweat plus profuse all over the body, cold clammy hands, salivation plus, thermally the hot patient was from heat, cold air, even warm air or a draft of air, better in open air, but was from the draft. Now mother history before and during the pregnancy, mother had a history of the dead baby boy stillborn before this child. After this, mother went into hysterical fits. She would lie as if unconscious with the clenched fist. If no one would be around, she would lie like this for 1 to 2 hours. She was diagnosed with the hysterical fit. The fit would come on if she would remember her dead child or anyone would speak about her child. So this is what hysteria after loss of baby. Nature of the child, since 1.5 months of the age, she started moving forward. Whenever she is kept down, will not remain at one place. She moves ahead even during the sleep. Whenever she moves ahead, it is with much pressure and force. If someone shouted at her, she startled. Used to get sudden startling in the childhood by the noise. Used to get shuddering with any noise. Restless, would not lie in one place or position. Does not like crowded places, accumulate money, play with the money, wants rupees. Even in a child, you can know what is the tendency to. I have seen even in a children, 1 month old baby taking hold of the pencils only or books only, or as a child grow up, even if it does not read, the child has only interest for the books, showing the diligent character in that child. Similarly, there is a children in 3 to 5 months of the age having a tendency to snatch the money. That is something called as a psychotic child, desire for money. Here, she would hold money so tightly that no one could take money from her. So much tendency for money was there. This is again an indication of psychosis. I have also seen children 6 to 8 months old who have a peculiar attraction toward only knives, something sharp and everything. A 1.5-year-old child of my cousin took a pencil and put it straight into his eldest brother's eye. See the syphilitic tendency of these children. Today he is so abusive, syphilitic, and destructive, people shudder to go near him. Anything happen, he will kick. This there is nothing sweet in the child. So you can think the reaction of the child can give you a Soric trait of the diligence, the psychotic trait of the desire and wants, and syphilitic trait of the destructiveness due to this tendency. So obstinate, angry, rage causes shuddering, epileptic seizure, seizure with the shuddering like a malaria. Whenever she urinate, she start crying and shudder. So this is what something you have to observe. If she were given something, she would hold it very tightly, and when someone tried to take it away from her, she would cry a lot and go into spasm and shuddering. Could not tolerate sight and smell of the water, used to get stiff, bouts of unconsciousness when angry. If milk was delayed, she threw tantrum, shrieking and shouting was common. Now she has started tolerating milk. She should she could not when she was in the sorry hypersensitive state. That is Sora is now gone. Now it is psychosis at work. Defense has now gone from the inflammation to the growth. Because of her disease, the parents were careful not to allow her to cry. Therefore, she started bargaining and emotionally blackmailing. So this is something every doctor, even the doctor told that keep this child very calm, otherwise he may go into a spasm or he may go into a breath holding spore, or he may go into this. So this is what the child started coping system, and child learned that if I am doing like this, they will take care of. So this is what emotionally he become bargaining and blackmailing. So the remedy was very clear. That is ill-willed remedy goes from the historical mother to the child having a peculiar consideration. So the remedy prescribed is something like a moscus. The peculiarity that led me to the prescribe her this was shuddering like a malaria. The Fatak has given clearly an epilepsy with the shuddering like a malaria is the only indications of the moscus. So very important, the one-liner rubric. Epilepsy with a shuddering like a malaria is the moscus. So excessive strength is also an indication of the moscus. There is extra hysteria means the little stimulus and excessive reaction. So this is what we have to understand. So nervous shuddering everywhere with the laughter, hiccup, etc. In the follow-up now, we will see the eye opening up. Within 1 week, the child stopped vomiting, giving me an indication that the irritation inside the brain is now going down, the tumor is regressing within. So in 1995, almost after a year, the eye completely opened, the internal tumor has gone. So in 1996, another 1 year, the tumor is regressing from the above downward. In a 2 year time, the Herring's law of cure is seen. The child's mother is now telling us that the surgeon has told her 2 years back to get the child operated. It is just a matter of 2 minutes, but 99% there is no guarantee of the child. The mother thought anyway the child is going to die. Then why should I get her operated and waste money? So this is what the mother is. In 1997, the 3 years much better cure seen from inside out and from out downward, but it is still not complete. Did you see the Herring's law? I waited 6 to 7 years for the Herring's law to come in this case. In 1999, now the child get an urge for a stool after eating outside food and the URTI. So this is the psoric symptom has to become. This is now the psoric. Bring the psychotic defense to the psoric defense. The immunity is now at the endodermal level. Now she is doing everything, playing, dancing, and also good at the study. She has started getting cold now. This is our job to bring the growth defense to the psoric inflammatory defense. Her constitution has not changed. She has just tempered down. Now the mother is presenting me, doctor, do something. She is getting this cold and cough. In between, she developed otitis and took allopathic treatment for that. Again, Moscus 1M was given, and she came down to the cold and cough. So you see how she has came down from psychosis to the sora, from above downward, inside out, more important, brain to the lesser important, and then to the least important, and the skin. So this is what you have to keep in your mind, the understanding of the case. So today we conclude this here, and tomorrow we will continue the chapter 19, and in chapter 19 we will continue with the approach to the pediatric cases. Again, see, the ailment is what the sensitivity of the persons and the reactions of the person. So here in this case, the ailment is not as the ailment of the cause of the. So cause is something else, but the reactions of the person is the deciding the process. So cause was that the really he was being deceived in the army consulate, that you was given a best, you was given a best job, but at the time he was given a job of mechanic. The actual situations was a deceived. But what was the reactions after that? He came to the India and he shows that I don't want to show my face to the society and the people, family members and everyone, because he was being embarrassed. So in that, the starting point is something, not it is related to after that he developed this disease. So in that point, it is not the deceive that caused the disease, it is the embarrassment of the person can cause the disease, and that is why the ailment from embarrassment was taken into considerations in this case. Shuddering of malaria. That is what the whenever the patient having a malaria, he develop rigors. That is called actual the word is the rigors. So whenever there is epilepsy with the rigor like a symptoms, you can think of moscus. So I will share with you this rubric. Maybe we will find in the Patak repertory. So hope you got the little idea of learning that how sir has given the only rubric was written as epilepsy with shuddering in the Patak repertory, and that guide us that it is only remedy is Moscus. So on the basis of that, sir has prescribed the Moscus. That is the PQRS syphilitic state of that person's. See, very obstinate, angry, rage causing shuddering. So again, there is an epileptic seizure with the shuddering like a malaria. Whenever she urinates, she start crying and shudders. If she were given something, she would hold it very tightly, and when someone tried to take it away from her, she would cry a lot, and goes into spasm and shuddering. So this was the remedy, which is very goes into hysterical state or a shuddering state. So whenever you find that epilepsy with the shuddering, the only remedy is Moscus. Hope you enjoy reading this, and we will continue our journey of pediatrics from the tomorrow. So case taking in pediatrics and how to approach the pediatric cases. Hydrocele is the tunica vaginalis. It is endodermal origin and it comes in the second layer. There is a tunica vagina which is endodermal origin and it is protecting the testes. So we conclude the day today. So thank you so much. Thank you all. At the end of this week, we will complete this book, and maybe from the next week or from the next month, we will continue the another book reading. Thank you so much. Thank you all. We call the day off. Thank you.